Did you know that there are over 100 types of arthritis? What percentage of people with rheumatoid arthritis do you think are women, and how many fall into the age group of 55 years or older? Do you know what causes gout, also known as metabolic arthritis? All about arthritis we will cover in this video. Arthritis isn't a single disease. The term refers to joint pain or joint disease, and there are more than 100 types of arthritis and related conditions. People of all ages, races and sexes live with arthritis, and it is the leading cause of disability in the U.S. It's most common among women, and although it's not a disease of aging, some types of arthritis occur in older people more than younger people. In the year 2019, a staggering 18 million individuals across the globe found themselves grappling with the relentless challenges posed by rheumatoid arthritis. A striking demographic insight into this condition reveals that approximately 70% of those affected by rheumatoid arthritis are women, underscoring the gender disparity associated with this autoimmune disease. Furthermore, more than half of the afflicted population, specifically 55%, falls into the age group of 55 years or older. Within this extensive cohort, an alarming 13 million individuals endure the burdens of moderate to severe forms of rheumatoid arthritis, a situation where rehabilitation interventions can play a pivotal role in improving their quality of life and managing their condition. In this informative video, we will delve into the realm of arthritis, shedding light on its diverse array of symptoms, underlying causes, and practical remedies. If you have any questions or seek personalized suggestions, don't hesitate to engage with us in the comments below. Your inquiries are valuable to us, and we are here to provide guidance and support on your journey towards improved joint health. Types of arthritis. Number 1, osteoarthritis. Osteoarthritis, OA, is by far the most common type of arthritis. It can damage almost any joint but mainly occurs in the hands, spine, hips and knees. OA was once considered a wear and tear disease in which cartilage, the protective layer on the ends of bones, wore down after years of use. But with further research, the thinking about OA has changed. Doctors now know that OA is a disease of the whole joint, not just cartilage. Bones in affected joints become weaker, the connective tissue that holds the joint together deteriorates and inflammation damages the joint lining. Contrary to decades of belief, inflammation plays a key role in OA, just as it does in most other types of arthritis. There's also a growing consensus that inflammatory OA is one of several subtypes of osteoarthritis. Other subtypes include OA associated with post-traumatic injuries, such as a torn ACL or fracture. Work-related damage from physically demanding jobs, such as farming and construction. Lifestyle factors, including excess weight, lack of exercise and poor diet. Although the prevalence of OA tends to increase with age, it's not an inevitable part of growing older. You can help prevent joint problems by staying active, maintaining a healthy weight and limiting foods that stoke inflammation like red meat, highly processed foods and sugar. Better bets: berries, leafy greens, wild salmon, whole grains and olive oil. If you already have mild to moderate joint pain and stiffness, regular physical activity, hot and cold therapies, judicious use of over-the-counter pain relievers and assistive devices may help manage your symptoms. When joint symptoms are severe, causing limited mobility and affecting quality of life, you may want to discuss a surgical solution with your doctor. Number 2, autoimmune inflammatory arthritis. A healthy immune system is protective. It generates inflammation to clear infections and heal injuries. But in inflammatory arthritis, the immune system is overactive, attacking healthy tissue, including joints in the spine, hands and feet. In some people, inflammation becomes systemic, damaging the eyes, skin, heart and other organs. Many, but not all types of inflammatory arthritis are considered autoimmune diseases because the immune system loses the ability to distinguish self from not self and attacks the body it's supposed to protect. Rheumatoid arthritis, RA, is the most common form of autoimmune inflammatory arthritis. Psoriatic arthritis, PSA, axial spondyloarthritis, AXS-PA, gout and juvenile arthritis are less common and can be more challenging to diagnose. It's not known what causes inflammatory arthritis in every person, but the general consensus is that something in the environment, a virus, stress, or smoking, for examples, can trigger it in people who are genetically predisposed. Recent research has also highlighted the complex and critical role of gut microbes in immune-related inflammatory diseases like RA and PSA. The trillions of mostly friendly bugs that live in your gut, skin, and mouth, collectively called the microbiome, regulate immune cells throughout the body and shape how the immune system functions in various diseases. When these vast microbial communities get out of balance due to poor diet, antibiotic treatment, stress, or some other factor, they may no longer regulate the immune response in a normal way. This is thought to be one of the key contributing factors to RA and other autoimmune-related inflammatory conditions. With autoimmune and inflammatory types of arthritis, early diagnosis and treatment are critical. Slowing disease activity can help minimize or prevent permanent joint damage as well as reduce pain and improve function and quality of life. Remission, defined as little to no disease activity, is always the goal, but low disease activity may be a more realistic target for some people. This is usually best achieved with a combination of medications and a healthy lifestyle, regular exercise, restful sleep, healthy food choices and less stress. The medication depends on the type of arthritis, the severity of symptoms and how well someone responds to a particular drug. For some people, the first medicine tried may not be the best fit. And some arthritis drugs can have unpleasant side effects or lose their effectiveness over time. It may take a few tries to find the right medication. Number 3, infectious arthritis. A bacterial, viral or fungal infection triggers infectious arthritis. It usually starts when an infection from another part of the body travels to a joint, usually the knee. Symptoms like swelling, pain and fever can be sudden and intense, but treatment with antibiotics or antifungals usually clears the infection pretty quickly. Most viral infections last a week or two and go away on their own. Some people with infectious arthritis may need to have their joint fluid drained to remove infected synovial fluid, reduce pain and inflammation and prevent joint damage. Number 4, gout, metabolic arthritis. Metabolic or gouty arthritis, commonly known as gout, results from a buildup in joints of painful uric acid crystals. These are a byproduct of the breakdown of purines, substances normally found in human cells and many foods, especially red meat, organ meats, some seafoods and alcohol. Normally the body gets rid of excess uric acid, but when it doesn't, it can accumulate in joints, causing sudden and intense bouts of pain, especially the big toe. However, most people with high uric acid levels never develop gout and many gout patients have normal uric acid. Some research suggests that certain factors in addition to uric acid might trigger gout. Possible culprits include damage from OA, disruptions in the microbiome and even white blood cells in the fluid inside joints. Some people experience only one gout attack, or flare, and never have other symptoms. They don't typically require medication. People who have more than one gout flare or severe symptoms are typically prescribed uric acid-lowering drugs. Those drugs can have serious side effects, and may not address the real problem, so in addition to taking medication, patients are advised to adopt a mostly plant-based, low-purine diet, rich in fruit, vegetables, whole grains, olive oil and low-purine fish. Now we move on symptoms of arthritis. Number 1. Pain. Pain is the hallmark symptom of both osteoarthritis and rheumatoid arthritis. However, the nature of this pain differs between the two. In osteoarthritis, joint pain tends to worsen with use, intensify as the day progresses, and subside with rest. Conversely, individuals with RA often experience pain at rest, and it doesn't exacerbate with joint use. Furthermore, RA may accompany a general sense of fatigue and malaise, whereas OA symptoms are usually confined to localized joint pain. Number 2. Stiffness. Stiffness is a prevalent symptom in both types of arthritis, but the timing and response to movement can help differentiate them. Osteoarthritis stiffness typically sets in after periods of inactivity and can often be alleviated through gentle stretching or movement. In contrast, RA-related stiffness is more pronounced in the morning, lasting for hours and limiting joint mobility significantly. This distinction in the timing and duration of stiffness can be a crucial diagnostic clue. Number 3. Mild swelling. While both conditions can lead to joint discomfort, the nature of swelling differs. In osteoarthritis, joints may feel achy and tender, but they often appear less visibly swollen or warm when compared to joints affected by RA. Swelling in OA can increase after physical activity and progress with the condition's advancement. Number 4. Bone spurs. Osteoarthritis can result in the formation of bone spurs around affected joints. These bony growths may cause fingers to appear somewhat deformed or make the base of the big toe appear larger. These visual cues can be indicative of OA and are less commonly associated with RA. Number 5. Reduced flexibility. Joint flexibility is compromised in osteoarthritis due to a decreased range of motion. This limitation in movement can impede various activities, such as bending over in the case of hip OA or fully extending the legs in COA. Number 6. Slow onset. One critical distinction between the two types of arthritis is the speed of onset. Osteoarthritis typically develops gradually over many years, while RA can progress relatively quickly, sometimes emerging over weeks or months. This difference in onset rate underscores the importance of timely diagnosis and intervention for RA. Number 7. Clicking or cracking sounds. The sounds of bones clicking or cracking during joint movement are often associated with osteoarthritis. These audible indications are the result of bones rubbing together due to insufficient cartilage cushioning. Number 8. Location in the hands. Both OA and RA can affect the hands, but they tend to target different joints within this region. RA often affects the knuckles, resulting in distinctive swelling and deformities, while OA more commonly impacts the end joints of the fingers. Additionally, OA can manifest at the base of the thumb, leading to characteristic symptoms. Number 9. Asymmetry. The distribution of joint involvement can vary between the two conditions. Osteoarthritis frequently affects one side of the body more than the other, leading to asymmetrical symptoms. In contrast, RA tends to manifest symmetrically, affecting corresponding joints on both sides of the body, particularly as the disease progresses. Number 10. Normal lab results. Unlike RA, which can often be detected through specific blood tests that reveal abnormal results, osteoarthritis is primarily diagnosed through physical examination and X-rays. This distinction underscores the need for a comprehensive evaluation by a healthcare professional to differentiate between these two types of arthritis accurately. Now we move on causes of arthritis. Number 1. Cartilage deterioration. While cartilage deterioration doesn't sound like a fun topic to cover, it's an important one. In the case of osteoarthritis, OA, we're talking about a degenerative joint disease that often involves the hips, knees, neck, lower back, or small joints of the hands. Point 4. You are more likely to find OA in joints that are overused. For example, a baker may get OA in the hands, or a runner could get OA in the knees. It can also be caused by carrying around excess body weight, which can lead to muscle strain and extra stress on the joints. Point 5. When the cartilage in any of your joints wears away enough, the bones begin to rub together, causing pain. In addition to being overweight or overusing particular joints, genetics may play a role in increased risk. Point 6 That's why we encourage you to lead a healthy lifestyle, so you can keep moving and experiencing joy. Number 2 Immune System Attack. If you have rheumatoid arthritis, RA, your own body may act like your worst enemy. Your immune system releases enzymes that attack healthy cells in your body by mistake, causing painful swelling in the tissues and lining of the joints in those parts of your body. Point 7. This autoimmune inflammatory disease usually involves various joints in the fingers, toes, hips, wrists, and knees. Point 8 Risk factors include family history, smoking, obesity, age, and gender. Women are more likely to develop this form of arthritis. There's no cure for RA yet, but there are treatments that can help slow the progression and relieve the pain. It's important to stay proactive to control the signs and symptoms and prevent joint damage the best you can. Now we move on remedies for arthritis. Number 1. Manage your weight. Your weight can have a big impact on arthritis symptoms. Extra weight puts more pressure on your joints, especially your knees, hips, and feet. Guidelines from the American College of Rheumatology and Arthritis Foundation, ACR/AF, strongly recommend losing weight if you have OA and overweight or obesity. Your doctor can help you set a target weight and design a program to help you reach that target. Reducing the stress on your joints by losing weight can help. Improve your mobility. Decrease pain. Prevent future damage to your joints. Number 2. Get enough exercise. If you have arthritis, exercise can help you. Manage your weight. Keep your joints flexible. Strengthen muscles around your joints, which offers more support. Current guidelines strongly recommend starting an appropriate exercise program. Exercising with a trainer or another person may be especially beneficial, as it increases motivation. Good options include low-impact exercises, such as walking, cycling, tai chi, water activities, swimming. Number 3. Use hot and cold therapy. Heat and cold treatments can help relieve arthritis pain and inflammation. Heat treatments can include taking a long, warm shower or bath in the morning to help ease stiffness and using an electric blanket or moist heating pad to reduce discomfort overnight. Cold treatments can help relieve joint pain, swelling, and inflammation. Wrap a gel ice pack or a bag of frozen vegetables in a towel and apply it to painful joints for quick relief. Never apply ice directly to the skin. Capsaicin, which comes from chili peppers, is a component of some topical ointments and creams that you can buy over the counter. These products provide warmth that can soothe joint pain. Number 4. Try acupuncture. Acupuncture is an ancient Chinese medical treatment that involves inserting thin needles into specific points on your body. Practitioners say it works by rerouting energies and restoring balance in your body. Acupuncture may reduce arthritis pain, and the ACR/AF conditionally recommend it. While there's not enough evidence to confirm its benefits, the risk of harm is considered low. Be sure to find a licensed and certified acupuncturist to carry out this treatment. Number 5. Use meditation to cope with pain. Meditation and relaxation techniques may help reduce the pain of arthritis by lowering stress and enabling you to cope with it better. Reducing stress may also help lower inflammation and pain. The ACR/AF recommend Tai Chi and yoga. These combine meditation, relaxation, and breathing techniques with low-impact exercise. According to the National Institutes of Health, NIH, studies have found that practicing mindfulness meditation is helpful for some people with RA. Anxiety, stress, and depression are all common complications of conditions that involve chronic pain, such as arthritis. Thank you for watching this video on arthritis. If you found this information helpful, please consider liking and subscribing for more valuable insights. Remember, you're not alone on your journey to better joint health. If you have questions or need support, don't hesitate to leave a comment. Stay well, and take care.